So our study was a single-center retrospective observational study in which we examined all patients, all consecutive patients with intracerebral hemorrhage, and we classified them in 3 groups: the patients with mixed location hemorrhage, patients with cerebral amyloid angiopathy, and patients with arteriolosclerotic small vessel disease. And we characterized these 3 groups of patients according to the demographic characteristics, clinical characteristics, and imaging characteristics. And what we saw was that some of the characteristics of mixed location hemorrhage patients indeed overlap with arteriolosclerotic small vessel disease, not so much with cerebral amyloid angiopathy. And one of the things that we also examined in our study was were the CSF markers for neurodegeneration when we compared patients with mixed location hemorrhage and CAA patients, cerebral amyloid patients, and we could see that only about a third of patients with mixed hemorrhage locations had evidence in CSF of amyloid pathology. We also found that ICH, intracerebral hemorrhage recurrence risk, was intermediate between patients with cerebral amyloid angiopathy and patients with arteriolosclerotic small vessel disease. So in conclusion, our study supports this notion that patients with ICH, with mixed location hemorrhage, do not have amyloid pathology as the predominant pathology as a cause for hemorrhage.